Hello and welcome to this video. My name's Kris, I'm an Australian GP, and in today's video I'm going to be talking about the changes to the cervical screening tests as of July 1st, 2022 here in Australia. Of course, you may know these as PAP SMEARS. They technically haven't been PAP SMEARS since 2017, but it's much easier to say than cervical screening tests. And most people probably wouldn't understand what we mean if we just said CST. So, there's been changes. There has indeed. If you'd like to know more, please keep on watching. If you're unsure about what a smear test is, please note that I have done a whole video on this explaining about what we do when we do a smear test, the instruments used, and basically what happens in the lab. But in summary, basically, a smear test is a test done by a practitioner with training to do them, whether it be a doctor, nurse, or other health professional, to determine your risk or possibility of you having cervical cancer. The cervix, of course, is the connection between the vagina and the uterus. It's kind of the bottleneck down the end. And what we do when we do a smear test, typically, is we use a duct-filled speculum to open the vagina to see towards the back, find the cervix, look at it, make sure it looks normal, then use a soft bristle brush to brush cells off both the outside and slightly on the inside of the cervix, send that away to the lab, and the lab will then tell us whether or not you have something known as HPV, which I'll talk about in a second, and whether or not your cells look normal or not. If things are all good, we won't see you for another 5 years for a screening test because we know that it takes at least 10 years for cervical cancer to develop without any early signs. So HPV. HPV is the human papilloma virus, which is a very common virus with about 200 or so different variations, though there's about 5 or 6 we are more concerned about when it comes to your cervical health. HPV can cause things like warts as well, and it's really common. It is so common that it's actually considered a normal part of being sexually active, whether you have sex with men, women, or both. As I mentioned, there's a half a dozen or so that really matter when it comes to cervical cancer. 2 in particular, HPV 16 and 18, we know do have a correlation with cervical cancer. The other subtypes, again, we know can be linked, but nowhere near as much. And believe it or not, we actually have a vaccine for that too. Vaccines are awesome, but this is not about that. And again, I'm telling you about what we already do, what we already know, and what was in my video before. So it's changed. Well, it all really comes down to HPV. We have been testing the cervix for a very long time, but research has found that HPV, particularly those that are linked with cervical cancer, are actually within the vaginal wall itself as well. Now, I'm not sure if you've ever had a smear test or know someone who has. They're not particularly comfortable. We as practitioners can do our very, very best to make it the least awkward and least uncomfortable and least painful experience possible. But there's no denying it. People often don't present for cervical screening because of how uncomfortable it can be. Now, because research has shown that we actually really only need vaginal tissue or, vaginal cells from the testing, the new guidelines actually suggest that you as a patient with a vagina can actually collect that yourself. So this is the world of self-collection. Self-collection itself isn't new. Previously, if you were over 30 and never had a screening test or were more than overdue for a screening test, you were eligible for self-collection. Now it's anyone. Anyone who's due for a smear test is eligible for self-collection, regardless of age or how long it's been. There's obviously some pros to self-collection. You do it yourself. You do it in the GP room, so we are there to help you. However, you just completely do it by yourself. You collect it with what looks to be like a very long cotton swab. Just goes into the vagina, swirl around, take it out, and that's that. The clear disadvantage, of course, is that your doctor, me, we don't get to see your cervix. Now, not every cervical cancer is linked to HPV, and when you collect it yourself, all we are looking at is whether or not you test positive or negative for HPV. There are some cervical cancers that are not HPV linked. Some happen out of nowhere, some are adenocarcinomas. So it's not 100% going to pick up every cervical cancer. That being said, the more we screen, given that HPV linked cancers are the most common, the more we're going to pick up and treat early. So it's definitely a good thing. I suppose I want people to know that you do have the option for me to do a traditional smear as well, so I get to see your cervix. And the other thing to highlight is if you have any symptoms whatsoever, vaginal bleeding when you're not expecting it to, pain during sex, abnormal discharge, or any sort of concerns, then it's actually not a screening test anymore. It's a diagnostic test or a diagnostic investigation. So I'm going to have to do a traditional smear anyway. The other thing is, if you do come up as positive for HPV, then I need to do a traditional smear after that too. So it is a great option because HPV is common, it is much less uncomfortable to collect it yourself, and it is highly accurate at picking up HPV, but just know that you may need a traditional smear in the future. And that's it, guys, really. Basically, long story short, TLDR, cervical screening is now available for everyone to collect themselves except in some circumstances. If you have any questions, please don't be afraid to ask below, or if it's pertaining to your own health, please do ask your own GP. Let me know what you want to see from me next, guys, but until next time, stay safe, stay healthy, and I'll see you in a video very soon. Bye.